Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications, which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hello there, my name's Alfie. I'm 70 years old. I'm married, happily married. I have 4 grandchildren who, unfortunately, because of the length and breadth of the country, we don't see as often as we would like to. My past is rather checkered in terms of job-wise. I started off out as an apprentice footballer and got a rather serious injury, so I had to pack that in, and I took up coaching, and for some time I was a professional football coach until I got fed up with that, in actual fact, because I really wanted to play. So I went on courses, university course, and eventually went into sales and marketing. I worked for 2 companies in my life. One was the Milk Marketing Board / Dairy Crest, where my job was to promote the sales of milk through both retail and through franchising. And I set up a franchise system within the dairy industry. From there I then moved on to packaging, and I worked for the largest European plastic manufacturers of plastic containers, which were used in oil, agrochemical, food, various industries. I took early retirement because I got fed up with working, and I took up golf as a sport, and I got quite good at that. And in 2010, I was diagnosed with cancer, and this is my story.
Alfie, thanks for coming in today to share with us your story. I know the viewers will be very interested in what's happened to you, because we haven't had many people who've come in with a head and neck cancer, or squamous cell carcinoma as it's sometimes called. I wonder if I could start from the beginning by asking you how your diagnosis came about, in essence.
Yeah, it was in 2010. I'd gone to the dentist to get a denture adjustment made because it was a bit slack. The dentist discovered that I had an ulcer in my upper jaw, upper part of my mouth, I should say, and said that because of that he couldn't take an impression. So I went back again 2 weeks later, and also unfortunately was still there. He immediately got on the telephone to someone who I later found out was the Leicester Royal Infirmary, and within 7 days I had an appointment, and I saw a Mr. Hayter, who was a
maxillofacial surgeon.
Beg pardon?
Maxillofacial surgeon?
Maxillofacial, that's correct, yeah. Yeah. It's a long word for me, is that, when you've got a mouth like mine. Yeah, and Mr. Hayter, he said like just, he was concerned about the ulcer and he would like to take a biopsy, which immediately made me think of cancer, and I did actually ask the question, and he told me that there's a possibility that it's cancer. He couldn't be sure, and the biopsy would tell us for definite, and it would also tell us whether it would be malignant or non-malignant. Obviously we were both concerned because I'd gone with Julie, my wife, and I feel now that was the right thing for Mr. Hayter to do. It was to tell me at the outset the probabilities of what I have to face.
Yes, and I know clinicians sometimes not sure what to do, but it's interesting hearing from you that you preferred a kind of open approach at that stage.
Yeah, I think if he had just given me a biopsy and not said anything, then I would have been tearing my hair out wondering what may be there and not knowing. But this way, at least I had an idea of what might be happening.
Yes.
Nothing was positive, obviously,
no.
And I lived in great hope that it wasn't going to be a cancer, and it was just some sort of lesion caused by the denture, but it wasn't. How
long until you found that out?
Approximately 4 weeks.
And that's a very nerve-wracking period, isn't it?
Unbelievable.
Yeah.
Unbelievable. I don't think I slept very much during that time, and but I was very fortunate in respect that I had a great amount of support at that time from my wife.
Yes.
And also from some very close friends who I informed.
Yeah.
But I didn't want to tell everybody because obviously at the end of the day, if there was nothing there, it's a mountain out of a molehill.
Exactly. Yeah. So when you then did receive that diagnosis of cancer, what was your reaction and approach then?
It's hard to put into words, but I suppose it's probably the lowest time of my life, because at that time I didn't fully understand what cancer was. I'd heard about it, I knew it was a terrible disease, but I didn't know what to expect. And it was only later, when I got to know what was going to happen to me, that the real fear came. But I was terribly upset.
So you did have further setbacks along the way, I think, but even at that initial stage, obviously it's very, very anxiety provoking. One thing that can make a difference is feeling that clinicians are on your side, or somebody's on your side. It can be family members as well. And did you feel that that support was really there at the beginning?
Not really. I was quite disappointed. On reflection, I think it was terrible.
From who? From
the hospital side.
From the hospital.
I do not think there was any help in me coping with what I was going to go through, both mentally and physically.
Yeah.
The Macmillan nurse, bless her, was as helpful as she could be, but a bit vague as to my particular problem.
Yes.
And it was a general sort of, well, you may expect this, you may expect that, but there was never any real care, I would say, at that stage, which was slightly upsetting.
Would you say that their approach was more physically orientated or more business-like? Was it the fact that the emotional side was missed out, or was it more a general thing?
I think that's a good way of putting it. It was more of a business way of approaching it.
Yeah.
It was, how you can say, if you take your car into the mechanic, it would say, you need new big ends.
Yeah.
It was that sort of approach.
Okay. I'm not sure everybody will know what the big ends are.
Well, big ends are in the engine at the bottom of your pistons and going up and down.
Okay, so they had basically a kind of a matter-of-fact business-like approach.
Yeah. Now, at the time, I was obviously upset by it, but I can see that why they do it that way, personally.
Which is what?
They try not to be too emotive and get too close to that person, because they've got to put themselves above that so that they can perform their jobs.
That's definitely a possibility.
Yeah.
Also,
that's how I look upon it. I might be wrong. But
some people say that there's also a pressure to see lots of people, and sometimes clinicians get a little bit desensitized to the whole thing. For that person who's got the diagnosis, it's a key moment in their life. For the clinician, of course, they do try and recognise that, but it's one of many diagnoses that they're facing.
Exactly, yeah. So, I appreciate that. I think, though, that there should be more help for people during that time, whether it's between the biopsy and the diagnosis, or immediately after. I don't know, but there should be some immediate help in what you're going to go through.
Yeah. So what was the next step then for you?
Well, the next step was to see various people. There was the people who were going to talk about what may happen to me afterwards. This was Mr. Avery, again a specialist there. And also there was the speech therapists, the dietitians, and the one that really sort of amused me was the anaesthetist. I mean, he told me to get some weight off, and I thought I was quite slim enough, right? But get a bit of weight off, he said, and stop smoking.
So they were preparing you for an operation that was coming up?
They were preparing me for a major operation, they said.
And what was that operation, for the viewer's benefit?
Big problem.
What was that operation?
Well, the operation was the most traumatic thing I think I've ever gone through. It meant taking away the left-hand side of my upper jaw, all my cheekbone, all the way around, the nasal bone on one side, and unfortunately my eye socket. Now that resulted in me losing a good 20/20 vision eye, which was a big shock to me.
Yes.
And they had to then replace the inside of my face with a flap, which was taken from my stomach muscles. And that was then sewn into my face and made for upper palate, half an upper palate replaced. And that's what the operation was.
How many hours do you think it was?
That was a 12-hour operation.
Really? So very intense operation?
Very much so. It was, because I asked a question prior to the operation if they could do something about the eye socket, i.e. take a bone from somewhere, from my hip or something, in order to build an eye socket so that I could have at least a false eye. Unfortunately, I would not have survived an operation that long. The 12-hour operation was probably the limit that my body was going to take at that time, and to take a graft of bone at the same time to put up there would be just too much for my body to take, and it would take longer to do it.
I understand. Were you anticipating losing the eye at the time when you went for the operation?
When I went for the operation, yes, they did warn me prior to that. I begged Mr. Avery at the time to try and save that eye, because it meant a lot to me to have two eyes, because I play golf. And, well, I was frightened out of my life, to be perfectly honest.
Sure. I mean, nobody can really tell how they'd react to that change in their body to such a significant degree.
No, I tried to look at what was going to happen afterwards in a blasé sort of manner. Try to make light of it, etc., etc. But unfortunately, it didn't work out that way. It was a devastating thing that happened. You
really felt it was a major step back after that operation?
Absolutely.
And was it the loss of the eye itself, that difference in the vision and the difference in the way you react to the world?
Well, the loss of the eye was a disfigurement. The scarring was a disfigurement. I mean, it's healed up considerably now, it's 2.5 years on. But at the time, it was horrific, you know. I mean, I'd have probably looked good in sort of a Frankenstein monster film or something, because it was that bad. The amount of stitches I had, I lost count after 100, you know, and it was really bad. And the fact that I lost that eye when it was perfectly good eye,
yes,
that hurt a lot. And yeah, it upset me a great deal.
So then you had a period where you're recovering, you know, after the operation, and there comes a period where you're trying to get to know your own body and what it can do now. And what did you notice immediately, the change in your vision and what you could manage in terms of your environment and your surroundings?
Well, obviously the operation took a great deal out of me in the first instant. I was very, very weak for months and months and months. But during my hospital stay, something terrible happened to me that set me back. I don't think I can really put it into words how bad it was for me in terms of how I felt, but I had a tracheotomy. Yeah. And during one particular night in hospital, well, I spent 4 weeks in hospital, by the way, recovering from it. One night during it, the tracheotomy got blocked up. I see. And I couldn't breathe, and I tried to summon help from the nurses on duty, and no one would come. And I was eventually thinking that I was dying. Yeah. I had to throw things around the room to draw attention to the fact that I was in such a state. Now that, after I had left the hospital, it took me months and months and months to recover from. As you know, for 6 months I didn't go to bed because I couldn't lie down for fear that I was going to die. I was on diazepam, just to sit in a chair all night long and get some sleep. This operation took place in February of 2011, sorry. In the April, I then went for my radiotherapy. Now, for those who don't know, radiotherapy for head and neck is a traumatic experience in itself, where you have to have a plastic gauze mask made, and you are then fixed to a table while they zap you with these rays. Now, as I couldn't lie down, I was always panicking every time I went for this treatment. I had to take extra diazepam, and I had to be coaxed to lie down, so I was more or less in stupor just to take my radiotherapy. That aside, the radiotherapy itself caused me major problems. I suffered terrible burns within my mouth. My lips were full of sores, my tongue was full of sores, the inside of my mouth was full of sores, my nose was full of sores and continuous bleeding. And I used to wake up and go to the bathroom in the morning and spend a good half an hour just clearing all the gums and whatnot away from my face. But that, eventually, after 6 months, I got over that.
So really, that was a side effect of the radiotherapy?
That was a side effect of the radiotherapy. And I think this is something that people who go through cancer suffer from more than they do. I use my own body as an analogy for what I want to say now. Yeah. 10 years ago, I had an aneurysm on my aorta. Yeah. That was a life and death situation. That operation was 8 hours. It was repaired. I would say 6 months later on, I was back to more or less normal. And that was a life-saving operation. Now this too was a life-saving operation, but I'm still suffering. 2.5 years on. It's not the kind of operation. Cancer is not the thing that just goes away. I think I've mentioned this before to someone. If I get a pimple on my face, I panic because I think there's something coming back. It's there. The after effects of cancer are continuous. See, I'm in a position where mine is in the face. It's there all the time for people to see. And people can see that I've suffered something. I feel for other patients where you can't see it.
A lot of people say now, you know, the cancer experience is a long journey. It's not just one incident like the diagnosis, which we used to focus on. It's a lot of experiences, including side effects and things that, you know, sometimes, quite frankly, we don't help the situation. At least initially, it causes a problem that then has to resolve on its own. But in addition to that, there's how do you start to get back on your feet? How do you adjust to the new you? You know, and what's it like living with that change? And that's a major thing as well, isn't it? Particularly for your cancer, where it's visible to others.
Well, that's right. I mean, even now, I don't like looking in the mirror. It affects me greatly. Although people do tell me, and I believe them now, but it's still hard for me to get to terms that it doesn't bother them. They don't see me as a disfigured person, which I do appreciate that. You know, and I think they generally believe and they generally mean what they're saying. But in my case, with the loss of an eye, as well as my vision was impaired because of, more so for the depth. And
yes, the depth vision, because using that too stereoscopic view to judge distances.
That's correct, yeah.
In addition, there's a visual field effect, because your eyes on the left would be seeing more of the left visual field.
Exactly, yeah. I do tend to have to turn my head more often, you know, but I'm getting used to that now. However, when it came to playing golf, it was a big encumbrance to me, because I couldn't quite get the depth.
Yes, it was a definite difference there.
Sorry, I've got it back again now. To be perfectly honest, I'm not as good as I was, but I'm still doing okay at the golf.
So that means that it's worth persisting with. If you feel there's a slight deficit, it's tempting to, in many of these situations, say, well, I can't do it like I did, I'll give that up.
Right, well, that's a good point, Alex, because what happened was, my golf pro, who's a good friend of mine, he made me play again. I think that's the easiest way of saying it. He forced me to go out onto the golf course and just do one hole. It was terrible. I couldn't even hit the ball. I was hitting the fresh air more than the ball. But eventually, with his persistence, I got playing 2 holes.
Yeah.
But I was still so very weak. And I should have, really, you know, I was scared. I was scared, and I'm still scared. And this is something I just can't get away from, you know. I'd like to think I was over cancer, but I know I'm not. And this is a worrying thing for me.
Yeah. It's not all totally back to completely normal and you can totally forget about it. And you've had a recent scare, haven't you? Which might mean that the issue's on your mind. You told me last week. What was that?
Yeah, one of the things that happened when you have radiotherapy, apparently, and I wasn't even told this until quite recently when this thing happened, is that your blood supply is restricted within your gums. Or can be. I'm not saying in every case, but in my case it was. And the dental people who I went to see, my teeth became brittle, and where the denture and the prosthetic bit of gum that they put in for me was held on by teeth. My teeth have now broken off and to the gum level. So I've got to go through some more treatment now in order to have special magnets put in Yeah, and they've given me root canal treatment, and they're going to put a magnet plug within this tooth, what's left of it, and then on the new denture, another magnet. So there'll be a positive and a negative magnet, and that will click it into place.
I've got you. I haven't heard of that before.
This is a new procedure, apparently.
Wow, that's amazing.
I'm quite pleased that it's taking time, because apparently the bloke who's doing it, it's very rare the amount of people who can do it. So yes. I'm very fortunate in as much as I'm a sort of a guinea pig, if you like. And hopefully it's going to work, because at the moment I've gone back to having to eat soft food again.
Yes.
I'm missing my old steak.
But you had built up to eating normal food, is that right?
Oh, crikey, yeah. I've been able to teach myself to eat all sorts of food just lately. You know, it took a long time.
Yeah. How long would you say after the discharge home?
I had a peg in for 18 months.
Yes, a peg is a
feeding
tube.
If you like, yeah. And
direct into the stomach, yeah.
Yeah, I have to put in Fortisam?
Fortisam,
yeah.
The build-up drinks.
That's right, yeah. So eventually I was able to suck through a straw. So I was doing the Fortisam through a straw, but my drugs I couldn't swallow, you see. And we had to crush the drugs up, mix them up with a liquid and pump them through. So it was very inconvenient for 18 months.
Yeah.
But Julie, my wife, she's a great cook. It's a business. She's a catering manager, like, you know, and she was concocting all sorts of food for me that I could eat. And gradually, I've worked myself now that I could swallow properly. I could chew food again.
So what was it that you were, when that difficult period was there, when you were just transitioning back to solid food again, what kind of foods could you manage? Because the viewers would like to hear a tip there about what they can manage if they've got a similar situation.
Well, providing you can swallow, and it depends, I suppose, on what type of teeth you've got left. I mean, I was very fortunate. I don't know why, but I seem to get very special treatment.
So you were saying there you had very good treatment from the orthodontist department?
Yeah, from the orthodontist department up at the Glenfield Hospital.
I see.
Yeah, Addie's her name, and she was a wonderful woman, and the denture they first made wasn't fitting right. It caused me some pain, and they were very patient with me. I'm obviously not the first patient they've had, but it seems that they were spending a lot of time just making sure that everything was fitting right. And
so come back to the food issue for us. What were you saying?
Oh, the food?
What were you able to manage when it was still slightly difficult?
Well, when it was still slightly difficult was what we used to do was we used to mince everything up. So I could have all the types of food that I normally would have, but it would all be minced up. And I would use a spoon and sort of swirl it around my mouth, as it were, and try to swallow. Now, nobody told me about that either, that I wouldn't be able to swallow immediately. Something I had to learn myself. And that was hard work, but eventually I got round that. And once they made these teeth, it took me some time before I could sort of chew correctly.
Yes.
So it was a very slow process going from Fortisam up into soup through a straw, and then I suppose eating like a baby, you know, baby food, and sort of sucking it and swallowing it that way. It was difficult, but it was a learning curve which I think I could have had more help for.
Yeah.
With getting over that problem.
That's fair enough. Okay, come back to this question of your body image, which is how do you feel about yourself as a person? Because I think the viewers would like to hear more about that. And you told me about that quite extensively last time.
Yeah.
Certain cancers do affect appearance and certain ones don't. I'm not saying those that don't are easy to handle by any means, but those that do affect your appearance have a special layer of complexity, which is that other people then see you for a changed person, perhaps, at least initially, when they think, you know, people tend to spot a change and then they get used to it. Do you know what I mean?
Absolutely.
And what did you find about going out and visiting friends and seeing the public?
It was very, very, very difficult. I became a bit of a recluse to start with. I wouldn't even go out the house.
Yeah.
And this, of course, concerned other people. It concerned Julie especially, my wife, but it also concerned my friends, my relatives, because I wouldn't even see them.
So you were a bit avoidant of going out?
I had avoided them, yeah, definitely.
Did you even allow them to come round to you?
No, I wouldn't have them come round because I didn't want anybody to see me.
Yeah.
So the way that was broken was quite amusing, really. It was my golf pro. He was on the phone to Julie all the time, and Julie was on the phone to him, letting him know how I was getting on, and my other relatives. But he weren't going to accept the fact that he couldn't see me. And he was a great guy, and he came round one day and knocked on the door, and Julie said, look, Chris, his name is, Chris Diageo, great chap, and he said to Julie, look, Julie said to him rather, Chris, he doesn't want to see anybody, he's refusing to see people. So he said, just step aside.
Yeah.
And he came in and he says, you're going to have to see me, Alf, you know, because, you know, you can't not get back to how you were.
Yeah.
And that was the bit that encouraged me, really, I suppose, because he wasn't shocked with what he saw. And at this time, you've got to bear in mind, I was still a mess to look at.
Yeah.
So eventually, with his help, but nobody else's, you know. This is a bit where I get annoyed. I mean, I know we've got this psycho-oncology unit. That psycho-oncology unit should have been with me right from the beginning. Right from the beginning, because I was suffering.
Yeah. I
was suffering mentally with the way I felt about myself, because I felt I looked horrific. I did actually, but I think I probably overemphasised the fact that it was as bad as it was, because other people said it wasn't. And it was a Macmillan nurse who recommended that I should have some help from the psycho-oncology team, which again surprised me, because I thought that my doctor would have done that. But apparently the doctor didn't know anything about the psycho-oncology unit. That I hope can be sort of amended at some time.
So you would have appreciated if that help from our team had been pointed out to you in an earlier phase, and you could have benefited from almost day one.
When I first started having treatment with the psycho-oncology team, I felt an enormous relief. I felt an immediate help. I felt there were some people there who knew what they were talking about, who could help me. That came across loud and clear. Both myself and Julie, my wife, felt the same thing. We did have a bit of a disagreement with yourself, Alec, because I didn't understand where you were coming from, but there I was in such a mess. But from then on, I think that what you've done, what Sue Todd's done, has been so beneficial that I think I shouldn't have suffered them months and months prior to meeting up with the psycho-oncology team.
I mean, the message I'm taking away is also that other people in a similar position should access, if available, similar services, and ideally services like this should be available elsewhere.
Absolutely. See, when people talk about mental health, we look at places like Broadmoor and things like that, but you don't look upon it as yourself. I didn't think that I would need mental help, and yet, because of what I went through, it was thrust upon me and I had no control over it.
Did you mind being referred to us in the early days?
Did I mind? I think I was a little bit reticent about going, because I didn't want to be thought that I was mentally ill.
Yes.
And I don't regard myself as being mentally ill.
No.
I regard myself as suffering a mental problem.
Yeah. And I think we would try and frame things with most people who come to see us as that you're struggling with an emotional issue that we don't necessarily need to put a label on, but we'll help you anyway. We'll just do, even if you've got a mild issue, we'll give you an appropriate intervention. If you've got a major issue, we'll address that too. We're not scared to address that.
That's what I'm finding. I'm finding that I have a sleep problem because of what's gone on, and I've had great help with that.
Yeah.
I have this fear of meeting new people. I've got over that. I can go into a restaurant now. I must admit that sometimes when we go into crowded restaurants, I tend to sit with this side of my face against the wall, away from the other people, but I'm not afraid now to go and meet strangers.
So what was it like then, venturing out and getting kind of feedback from people, some of whom you didn't know? It must have been scary to put yourself in that situation.
That's right, and just to be perfectly honest, I thought everybody was looking at me. I felt like the Elephant Man. I thought that, what had happened to me was so disfigured that people would be attracted to it like a magnet. But that weren't the case.
What was the case?
The case was I wasn't being noticed.
Really?
Yeah, but it took me a long time to realise I wasn't being noticed.
Yeah.
And I think, I've said this before, and I've said it on a previous time, about this little boy I met.
Yes, tell us that story.
Yeah, we'd ventured out, Julie and I, to a supermarket. And this was my first trip to a supermarket since the operation. And I knew it was going to be in close proximity with people who would, if they were going to notice it, would notice it. And Julie was talking to a woman over a fridge, and they were discussing prices, as women do, about things in the deep freeze. And they had a little boy there, about 8 or 9 years old, this woman, and he kept looking at me. And at first, it sort of worried me. But then I saw in his face like this sort of curiosity. He was looking at me with interest, if you like. And so I said to his mum, I said, look, I've got a disfigurement. I said, but your little boy keeps looking at me, can I talk to him? She said, certainly, she was a lovely lady. So I sort of got down on my haunches and I said to him, are you looking at my face, Sunshine? And he said, yeah. I said, because he's looking up, you see, and he could see that under these glasses, I didn't have an eye. And because of his curiosity, I gave him a little story about how it came about and what it was. And I said it was cancer. And I'd had a big operation to get rid of this cancer, which is very, very naughty disease, and it's not the sort of thing people want. And he said, well, how did you get the cancer? And at first I was a bit lost as to what to say, but then I said, well, I believe it was because I used to smoke cigarettes. I said, nobody's actually said that, but that's what I think it was. He says, you know what, mister, you have to excuse me, because this was a life-changing moment. He says, I'm never going to smoke. I said, sorry, and what that little boy said did so much for me, because if nothing else, that little so-and-so ain't going to smoke, he's not going to get cancer. That's how I looked upon it. And bless him, he made me feel so good that day, because I was able to open up to somebody I know he was only a young lad, probably doesn't fully understand it, but I think I did a bit of good there.
I mean, from my perspective, you were in a slightly vulnerable position, having just ventured out, and you had that interaction, which, you know, was a sensitive one. It could have gone badly in a way, but it didn't.
No.
You both benefited from it. And then, you know, maybe there was, you can take on board that venturing out can have positives in life and as well as negatives. You know?
Yeah.
It's not just going to be bad things that are going to happen.
That little boy, he did a lot of good for me. He really did, because hopefully that he'll remember that for the rest of his life.
Certainly.
Yeah.
And what was your general experience then about venturing out? Because it didn't suddenly become all easy, did it, after that?
No, it's very difficult. It took me so many months to have. It's like having to become a new person. I've always been bold, outward, in your face, if you like.
Yeah.
I've always been that sort of person.
Yeah.
And this made me a bit of an introvert, definitely a recluse at the beginning. And I was, because of the way I was in life working, I was always meeting people and could talk to people. This way I couldn't talk to people very well. I was frightened quite a lot of the time, and it took me ages and ages and ages to really want to go out and want to go and see people.
Yeah.
Now, I mean, I'm getting that way that I can quite enjoy taking the mickey out of myself most of the time, you know.
So I've noticed you have a good sense of humour as well. And is that a mechanism to cope with it? That's your natural style?
Yeah, I think it is actually. But I've always had that sort of sense of humour, though. But I can take the mickey out of myself quite a bit. For instance, if I have a bad shot at golf, like it because I look through this eye and not that one, you see, and things like that. And people can accept that, and they laugh and they joke about it.
Sometimes having a sense of humour introduces an acceptability to the conversation that means that the person who receives that information knows that you're okay about it. Because you can make light of it, it proves that it's not bugging you too much. So then it introduces the acceptability of the discussion about the topic into the conversation.
I think I can agree with that, Alex. I think that's absolutely right. I have noticed that, you know, if I'm sort of a bit blasé about it, then they can come to terms with it a lot better, and they don't feel embarrassed by it. And I think that could be a key point in what's going on. Yeah.
Because one of the issues when you're talking about physical illnesses that are visible to others, sometimes the problem is partly how you feel in yourself, but sometimes it's other people's reactions, even those that don't know what to say and maybe slightly avoid you. You were talking about avoiding other people, but the reverse can happen when people avoid you because they don't really know what to say.
Yeah, I can't honestly say whether I've noticed that. I can't. No, in all honesty, I don't think anybody's deliberately avoiding me.
No.
No, they haven't.
I think with good friends, they'll try not to because they want to regain the quality of the relationship that you had before. So,
well, that's probably true. But I don't think I've ever, honestly, can say I've had any negativity from strangers, friends.
No negative comments or anything like that?
No, I've had people make interesting comments.
Yeah.
I've had people ask me how I feel about certain things. I've heard people, majority of people say, well, you don't look any different.
Yeah.
And of course that's when I say to them, but I'm not the same as I was. He said, well, one particular bloke said, well, you're always ugly. So, can't win, can I?
I hope you told him where to go. So, I mean, in a way, you deal with those comments, your own way.
Yeah. I like to think I'm a strong person.
Yeah.
And I'm getting that strength back now.
Yeah.
Although I did lose it at one time, I think with the help of yourself and your team, that's come back, help people around me.
One thing I'm wondering is a marker of, if you like, how people are doing, is whether you feel you've had any achievements since your diagnosis, since you've had these setbacks. Sometimes doing something, even if it's something new, can give you a message that, there's still positives I can get out of life. Yeah. Have you found that you've been able to participate in anything that's been memorable for you?
Well, yes. We've had 2 holidays over the last few months, a year or so. One of which was a river trip up the Danube. Now on these particular little boats, there's only 200 people, so you're in close proximity with these people all the time. This was the first trip abroad, the first time I've flown since the operation, which I was worried about. But we had to share tables with 3 other couples, so there was 8 of us on a table, and they happened to be Americans. And these Americans did notice my disfigurement, slight disfigurement to them, and they asked the questions, what happened? Have you been in an accident? And I said, then I told them about the cancer story. And one of the other things that was quite remarkable about that trip was that we had the same waitress every day, and she was a wonderful person, but from the very first time I had a drink and I asked for a straw, so every time we went for our meals, be it breakfast, lunch or dinner, there was a straw placed with my cutlery, and I found that quite remarkable. There was a person who was recognising that I needed something extra, and only a straw, but it meant a lot to me.
Yeah. And
it also meant a lot to me that these people, these Americans, accepted me for what I was.
Yes.
Then we had another trip, and we went to America, and we went on the usual tour bit and we're meeting all sorts of people, and nobody even mentioned it. And that was another remarkable thing. So I got an inspiration from that in that I was putting too much emphasis on my disfigurement myself, and it wasn't really all that to bother about. I think that really helped me.
And during that trip, I think you told me that you were challenged to a game of golf where they wondered how you'd do or something?
Yeah, we had a game of golf. This is the second trip. We stayed with some friends as well, and we went out and we played, and I beat them. Now this was really inspirational, and so they said, "How do you do it?" And I said, "It's because I've got one eye. That's the only reason." And I also went, because the Americans are big in guns. We went to a shooting range. Rifles, pistols, and I outshot them as well. But I used to do a lot of shooting before. But I actually beat them at target shooting and everything, and they were quite amazed by it. And I said, "Well, you keep closing one eye, don't you?" And they said, "Well, yeah, that's right." So I said, "Well, I do as well." So, yeah, that helped me a lot, that I could be accepted as a normal person, and that was important.
Yeah. I know people will be wondering then, 2 to 3 years down the line, how much recovery has there been? In other words, how much of your normal self have you been able to get back to? Are there still some sticking points that are problems?
Yeah, quite a lot. Motivation is still very difficult. I struggle, especially if it's a physical task, to get myself up and going. It took me a long time. I've had a lot of help from one of Julie's cousins, he's come round. We've got quite a large garden. He's helped us out, and he's been doing my gardening for me because I could not get myself to do it. Now, however, I'm getting back to the stage where, take yesterday for instance, I thought that it was a lovely day. I've got bad weather coming in, they reckon. So I got out and I mowed the lawn. Now, 6 months ago even, I would not have been able to do that. So I look upon that as good progress in terms of getting back into wanting to do things because they need to be done. My strength is not all back yet. I still get very tired. I still have sleeping problems, etc. But in general terms, I would say I'm 3/4 of the way back, if I can put a figure there.
Can you measure this using your golf interest? You know, because I know obviously you can do a half round, you can do a full round, 18 holes. What have you noticed about your ability? Not so much your accuracy, but more your stamina.
Well, this last few weeks or couple of months or so, I've been quite good. I can do the 18 holes now quite comfortably and not feel tired afterwards. Prior to that, you know, doing 18 holes was a bit of a strain. The amount, I can't hit a ball as far as I used to. My body won't allow that, but that's basically because of the operations to take the flap from my stomach has caused me to have a hernia. So I know why there's a restriction in what I can do in them terms. But in general terms, I'm able to do most things if I'm allowed to. Now, because Julie is very protective and she tends to mollycoddle me a little bit, which I love. Don't get me wrong, you know, if I don't have to do a thing, I won't do it.
Well, you've raised an interesting point there, which is what is the best reaction of family and friends, particularly close family? Should they protect the other person and allow the other person not to do things that they otherwise perhaps could do? Or should they say, come on, this is, you know, an area that you could probably manage. Why don't you have a go at it?
Well, I think there are a couple of ways of looking at that. I mean, providing you've got a partner, be it a wife or a husband, boyfriend, girlfriend, or whatever, who really cares about you, there's a lot of things that they do that benefit you. I have to laugh because Julie does things to help me, and she makes lists. She writes out a list of little jobs. Do this, do this, do this, which helps me both physically and mentally. Mentally, because sometimes I can't think of what to do, so there's a list there that makes it easier for me. But at the same time, it motivates me because she wants me to do something, so I'm doing it not only for myself, but I'm doing it for her. The only little tasks, she might say, get the flies out of the blinds in the conservatory, because they always seem to get behind there.
I see she gives you the glamorous tasks to do. She gives you the glamorous tasks, the nice ones.
Yeah, you could say that, yeah, like just wipe the windows and... But it does, it motivates me to do things.
That's called activity scheduling, you know, where you set out the goals and you put on a list what you're going to do, and then you can have an objective to aim for.
That's right.
And then it basically gives you a little bit of extra motivation. Well, it fills in, if you like, when your motivation can be slightly lacking. Yeah. And that can be very helpful.
Oh, it is.
And people should know they can do that themselves by writing their own task list for the upcoming week.
Yeah. I don't have to do that. It's done for me, like, you know.
Yeah, but you've still got the job of doing the tasks. So that's the main thing.
Yeah.
So she's definitely helpful. In general terms, how do you think she's managed with all this stressful time?
Well, Julie keeps a full-time job, and I believe it does affect her life greatly. she never stops worrying. I try to make light of things. I don't tell her when I'm feeling down. I don't tell her when I've got any pain. I don't tell her most of the things, so I don't worry her. Because she's such a caring person, you know, I think it's unfair that I should burden her with, you know, trivialities, if you like.
Yeah. One thing we want to improve is support for carers themselves.
Well, she's had no support.
Yeah.
That is sad, and I totally agree with you, because I could see that she could do with some help. You know, be it just going to meet in a tea room or something. But you know, it's but she devotes her time to me. She doesn't even think about herself, and that is sad, because I'm sure that she's not on her own. I'm sure that other partners and friends are suffering for other patients, because they're not getting that support that should be there, which isn't there.
Agreed. Where do you see yourself going from here?
Where do I see myself going? Well, I've come a long way. I've come a really, really long way compared to how I was 18 months, 2 years ago. Where do I go from here? I'd like to think that I can get my strength back fully. I'd like to think that I can not worry so much about what's going to happen in the future, and live more for today and stop thinking about the future, which is a big concern for me. Not so much for me personally, but for Julie and other things. I'd hate to think that she'll be left on her own, you know. But I don't think I'm going to go that way. I think I'm overcoming this cancer, both physically and mentally.
Well, that's good to hear.
Yeah.
Are you making any plans for the future? Anything coming up?
Well, we're hoping to sell our bungalow, and we're hoping to move to another place. In fact, we've got an offer been put in, but I'm not accepting it. And we're hoping, what I would like really, trouble is she's going to see this, but yeah, all right. I tell you what, love, I want to take you around the world again. We've been round once, we did a round the world trip, I'd like to do that again.
Maybe you go the other way this time.
Go the other way, yeah, yeah, and probably take a little bit longer as well. That's what I want to do, yeah.
Well, it's good to have targets, isn't it?
Yeah.
And good to have objectives. Let's have a think now from the perspective of somebody watching this who's at the beginning of their cancer journey. Is there anything you'd want to say to them, or any tips or advice?
It's very difficult, really. Cancer is a terrible, terrible disease. It's a rotten disease, and there's no easy way of saying it's going to be a good trip, because it's not. It's a difficult trip, both physically and mentally. But at the end of the day, there is light at the end of that tunnel. Providing you set your mind out to beat it. I was not going to let it beat me, but I had a lot of help along the way to beat it. I couldn't do it on my own. I needed help, and I would advise anybody that's going to go through this, who's just been diagnosed, for instance, to seek out help as much as they can and not try to take it on their shoulders themselves. That's the only bit of advice I can give.
Well, I think that's a key point, and I support that 100%. So I want to thank you today on behalf of myself, Heather, and the viewers for coming and sharing your story. I personally find it a very inspirational story. Not just the cancer, but how it's affected you physically, and then how to fight that in a way and overcome those obstacles. Those are all challenges that you've met, and you've improved, like you've said, you know, you've improved an awful lot along the way over that period of 2 to 3 years. So I'm sure viewers will find that an inspirational account to hear.
Well, I hope they do. I mean, I hope that they can get some benefit from what I've said, but That's up to them.
Thanks for coming in today.
You're welcome.
Take care.
Thank you.